after that, Amy will get into more of the integrative approach since that's kind of her specialty. All right. So what is MTM? So MTM, or Medication Therapy Management, it's a service provided by the pharmacist. It uses our role as the medication expert. So that's kind of where our training is really focusing on medications, interactions of medications, issue adverse effects of the medications, how you might be able to take them a little better. We'll talk about some of those things as we go. But that's kind of our role, and how we can optimize your medications and optimize your treatments to make sure that you have the best therapeutic outcomes, or the best, like Jenny said, to improve your life as best we can through your medications, okay? So the big part of that is making sure you're getting the most benefit as possible, and that's all medications, not just prescriptions like you naturally would think about with a pharmacist, but your over-the-counter medications, your vitamins and minerals, your herbal supplements. All right. So it also is used to identify and prevent costly medication problems. There's a slide that'll come up that'll kind of talk about the dollar amounts, which is pretty staggering. And if we can help with those things, it's certainly part of our role too. So making sure that you're using medications appropriately, make sure that you don't have multiple medications where maybe you would only need one, those kind of things, or make sure you're not taking unnecessary medications. Also making sure if there is a chance where if you have a condition, maybe there's a medication that you're not taking that might help prevent hospitalizations or prevent progression of the disease, those kind of things, and much more. There's a lot of other things that we'll talk about. So the kind of outline of this talk will be the 5 core elements of MTM. So we'll kind of start at the top and go around the circle clockwise as we go here. So starting with medication therapy review. First, prior to your visit, we'll collect some information. So here we're lucky enough where we have access to your clinic records if you see somebody in our clinic, so we'll kind of look through those kind of things. We might talk to your provider and see if there's anything specific that they have that they're thinking of that we might want to talk about. Getting access to your medication list and having that ahead of time. Looking at your refill history if you fill with our pharmacy specifically, to make sure that you're taking everything, it looks like as it's prescribed, those kind of things. Looking at your vaccinations to see if we can make any suggestions from that. And then having a pre-appointment questionnaire that just kind of helps streamline the process when you do come in and visit with us. So the medication therapy review is kind of the first step, and that's if you come in and visit with us, bringing in all the medications, so we have everything that you're taking, updating that, and kind of reviewing those things and making sure everything's going okay, you're not having any issues taking medications. If you are, if there's any way that we can help that, checking your diseases and ailments like I mentioned earlier, see if there's anything that you should be taking that maybe you're not, or things that you shouldn't be taking that maybe you are, those kind of things. And then also looking at vaccination status, lifestyle factors, which Amy will talk about a little more, but we're not just the medication experts as far as what you're taking and how you're taking them, but also your conditions and how you might be able to improve those. So besides medications, whether it's diet or exercise, those kind of things, making sure that everything's going to help you and improve your health as much as possible. And then future, and Amy will talk about this a little more, just kind of briefly, is pharmacogenomic consults, which sounds a little scary, but Amy will talk about that. It's really some exciting stuff that hopefully we'll have coming shortly. All right, and then the personal medical record. So basically what this is going to be an updated medication list. So part of the visit will be you'll bring in all your medications. We'll make sure we have records of exactly how you're taking those and get that updated. It'll also have your allergies as well as medications that you have adverse effects from that aren't allergies, but issues with taking certain medications. So we have that updated. And then you'll have that record of what your medications are, and it'll be a good record. It's always good to have a medication list on hand. We don't want to obviously have any bad problems happen, but if you end up in the emergency room, if you have an accurate medication list, that can definitely help prevent any issues. Just always important to have a good medication list at all times, and this will be kind of the base, and then you can kind of add to it, and we'll talk about that a little more too. And then sharing this with your primary care provider, which is part of the process as well. All right. So the medication action plan. So after we meet, and part of meeting is we'll be talking through the medications, making sure we have an accurate list, making sure if there's any issues, any suggestions we might have, whether that's changing the time you take something, separating medications out, maybe taking an over-the-counter product that might help, those kind of things, anything that's in our scope of practice. If we have a suggestion.
89 or 92, please call the front desk. 89 or 92, please call the front desk.
Okay. if we have any suggestions, such as maybe we think, you know, your blood pressure's been running a little low, maybe we could decrease that blood pressure medication. That's a little outside of our scope of practice, so that would be a recommendation to your provider, those kind of changes. Maybe, you know, like I mentioned earlier, if it's a medication that you could be taking that might improve, making that suggestion, and that's the next step of it, and that's the intervention or referral. So intervention being, if it's a simple timing change or adding something that, you know, over the counter, those kind of things, we can make those suggestions to you, make that part of your action plan. Typically in a visit, we'll sit down with you, talk about those things, and then send you a letter afterwards with all of our suggestions. We'll talk about that a little bit more in a slide or two here. But just having that, the intervention of make this change or do that. The other option for intervention is, like I mentioned, a referral to your primary care provider. Maybe it's a diet thing, or if there's a food intolerance or something, making a referral to a nutritionist or a dietitian. Making a referral to physical therapy if you're having pain, and instead of just treating the pain, we want you to see physical therapy to treat the source of the pain. Those would be referrals to your primary care, who would then make those referrals. Okay. So, like I've mentioned a couple times already, but the main goal of this is to optimize your therapy, to optimize and make sure your medications and your life can be improved as much as possible. And then the documentation and follow-up. So a big part of our process would be not just the visit, but then sending that letter to you, documenting in your clinic record what we talked about, and then any recommendations we might have, so your primary care provider has access to that. Talking about recommendations that we have to the provider, whether that's in just a note or a face-to-face conversation with your provider, to just kind of let them know, here's what we talked about, here's some kind of ideas that we have that might help. Okay, and then as always, the goal is to develop, provide, and achieve the best patient-centered care possible. So Amy will talk about more of the integrative medicine portion of it, but I'm not trained in integrative medication, but that doesn't mean we're not looking at the patient-centered care, which I think integrative, the main goal of that is, as anything really should be, is patient-centered care. So I will focus on guidelines and, you know, more, say the guideline says you should take this medication, but patient-centered care, maybe that's not necessarily appropriate for you, and it might be for the general population, those kind of things. So why is MTM needed? So this stat is a little misleading. It says 40% of US citizens live with a chronic disease. That is, it doesn't seem like that should be a little higher, is what I'm thinking. So that's the general population. Once you get to a certain age, that percentage is going to soar. So yeah, sorry, yeah, you bet. So yeah, that number is 40% of the general population, but like I said, that number is higher once you get to a certain age. So very important. Chronic diseases, things that we can help manage and take some of that burden off of primary care. 1.5 million preventable medication-related adverse events. Like I mentioned, if we can help prevent some of those drug interactions, if we can have you take medications at a certain time that are going to help prevent those things. And then $21 billion, this is the number I talked about earlier. It's a pretty staggering amount, and that's due, dollars that are spent due to preventable medication errors. So Amy and I aren't going to be able to make a huge dent on that, but we can do as much as we can to kind of help lower that number. And not just lower that number, but that number means that people are having issues because of their medications. If we can help prevent that, besides the dollar amount, that's going to, you know, improve quality of life as well. So who would benefit from MTM? So if you look through this list, we can basically make an argument that almost anybody would. So transition to care. So whether if you were just in the hospital and now you're going home, those kind of times can be confusing with medications being added, changed, decreased, discontinued. We can help with that. If you have multiple prescribers, which is really common, if you see somebody here for primary care, you have a cardiologist, you have a kidney doctor, a neurologist, all those different things, that can get a little confusing because you're getting prescriptions from a lot of different places. We can help kind of narrow that down and get those to work as well as we can for you. 5 or more chronic medications, which is pretty common. At least one chronic disease, which that last slide said that 40%, and I said it's probably a little higher, so we can, you know, put a lot of people into that area. Non-adherence, whether you're not taking something, if it's for you're having an issue with it, or if it's hard to remember to take it twice a day, 3 times a day, those kind of things, we can help kind of make that a little easier as well. Smoking cessation, we do have a good tobacco cessation program here, but us as pharmacists are definitely trained in that as well, so we can help with that. Cost of medications, we talked about the dollar amount. Just specifically the cost of a medication. If you're taking one that's a little more expensive than something that's pretty similar, we can help make that change too. And then just in organizing medications. It can be a little tricky if you're taking 8 to 10 medications of, I don't know when to take this, this, and this, and how do I time it, and those kind of things, we can help with that. And then the value, so it's I think a really big value. We talked about the dollar amounts and helping with that. If we can help kind of make your medication life easier. So make it easier for you to take your medications, make it have less side effects. If we can ease the transition of care, those kind of things, if we can help with those kind of things, I think that's going to be the main benefit of just making your medications work better for you, improving your outcomes, and then making your life better. Okay? And then, like I mentioned, just the cost burden alone, we can definitely help with that. Whether it be the cost of the medication or just reducing hospitalizations, reducing number of medications, those kind of things. So value to St. Elizabeth's, I think for us as pharmacists, the value is we're trained in medication. That's our expertise. So if we can put that to use, this is such a great way for us to use what we've learned and to go beyond the typical day-to-day operations, but to actually sit down face-to-face, go through everything, make sure everything's working well. Incredibly rewarding. I think it really helps people, and it's just satisfying to be able to help with that. But then also taking some of the burden off of other healthcare providers. So your primary care provider doesn't always have time to sit down and go through them as detailed, every medication as detailed as we do here. So taking some of that burden off of them so they can focus on other things and help your health in other ways as well. Okay. And then I will turn it over to Amy for the integrative approach and the integrative service.
Thank you. So, again, I'm Amy Sapola, and thank you guys so much for being here. One quote I really like is: a medication that fails to produce the desired or expected therapeutic outcome is clearly cost ineffective regardless of the price. And I think that's something we don't always consider. Sometimes we get on medications and then you keep taking them, but they're not really doing a lot, and nobody ever really takes you off. And so that's something with medication therapy management that we also consider. So I'm going to really talk about the integrative piece. And as Dr. Arietta has talked about before, that's incorporating a lot of different areas. So I personally like this quote because I think the foundation is really the most important thing. So no amount of medication or supplements can cure an unhealthy lifestyle. And so when you work with me, one of the things we talk about a lot is lifestyle. And that's the foundation, because we can't work magic. We have to at least start with a solid foundation. And some of the things, and most of the things that we'll consider, are in this wheel. So the spiritual, the emotional, intellectual, physical, social, environmental, financial. There's so many pieces to your wellness. Self-care is really key. So when we talk about mental, emotional, and spiritual well-being, looking at these areas, are you feeling gratitude every day? Are you able to express yourself? So many different areas that contribute. Also, your social life, family relationships, being able to spend social time with people that make you happy, spending time with people that make you laugh. One thing when we get to physical is finding physical activities that maybe you can combine some of these things. Maybe you're doing something social in an atmosphere that's fun, you can laugh, you can get some exercise. So you could try out, for sure, goat yoga. There's also Dogga, if you want to get your dog involved. So again, finding where's the baseline. So are you physically well? Are you exercising, drinking plenty of water? Are you sleeping? Are you breathing? Are you taking time to actually take deep breaths? Are you eating a whole foods diet that's rich in colorful fruits and vegetables, like Dr. Arietta had talked about with the Mediterranean style diet? All of those things make such a difference. And then professional life, work, career, are you satisfied in those areas? So the next portion, I'm just going to talk through a couple common supplements and some issues we see. And a big question I hear is, do I need to supplement? Is this something that's worth doing? So one quote I love from Dr. Lodog is that osteoporosis is a disease of childhood that manifests in old age. And so by the time, when you're about actually built all the bone that you need for the rest of your life. From there on, you're literally just maintaining it. So oftentimes we see people taking way too much calcium as supplements. You have to consider with calcium that it comes from your diet as well as your supplements. So calcium can be extremely beneficial in so many different ways, and depending on your age, depends on how much you should take. But again, it's diet plus supplements. It's important also to consider that when you're taking calcium, you don't want to take more than 500 milligrams at a time. If you're taking more than that, you're not absorbing that much. So you can take all you want, but your body can only absorb so much at a time. So it's best to space it out throughout the day. And I would argue for most people, 500 or 600 milligrams is probably the most I would take as a supplement, assuming you're getting some in your diet, and we'll talk a little bit more about that. Calcium carbonate is good. That's also available in Tums. It's best with food. If you have any issues with acid, so if you're on an acid suppressing medication, or you're greater than 50 years old, calcium carbonate probably isn't the best version of calcium for you. I would go with the calcium citrate, which is better absorbed, and you don't necessarily have to take it with the food. Calcium is actually interesting because it has the most potential drug interactions among the commonly used dietary supplements. And that's because it really tends to bind up with a lot of different medications. So it can bind up with thyroid medications, with some antibiotics. It can even bind up with other supplements, other minerals. So it's one that's really good to space away from other medications and supplements. One thing I also like to talk about with calcium is that Tums does contain calcium. So if you're a regular Tums consumer, you are getting calcium from Tums as well, and you want to be careful about the total amount of calcium you get in a day. Calcium is one of those things that you want to get just the right amount. If you have too little, you certainly have risk there as far as osteoporosis goes. But if you get too much, it also can increase your risk of heart attack and stroke, especially when you're getting too much from supplements. So they say if you're getting over 1,000 milligrams from supplements, or if you're getting already over 800 milligrams from your diet plus supplements. So being cautious about that also increases your risk of kidney stones if you're getting too much calcium. So in food, one of the things I like to talk about is there's a lot of foods that do contain calcium. So you'll see here sardines, amaranth, some greens, sockeye salmon, white beans. There's a ton of different sources. And you add it up all throughout the day. So most people are getting a decent amount of calcium, and there's a ton of other sources too. These are just a few things. But what I would say is that if you are taking other medications, a big one is a thiazide diuretic, so like hydrochlorothiazide. That can actually increase your risk of high blood calcium because you're not losing as much calcium. So that's another case where you want to be careful about supplementing with calcium. Also, sometimes people talk about the calcium in these things being bound up because they do bind to oxalate. So oftentimes cooking, like greens, or having a little bit of acid with it can help you absorb that calcium a little bit better. So the next thing is vitamin D. And on this slide, I do have a few different pictures of vitamin D rich foods. So cheese, dairy, mushrooms. And mushrooms are interesting because mushrooms have vitamin D2 in them, but only if they've been exposed to light, which they don't really say on the package all the time. But essentially, you want mushrooms that have been exposed to light if you're looking at mushrooms as a source of vitamin D. Also fatty fish and eggs. And you need both vitamin D and, you need vitamin D to help absorb the calcium that you're getting in your diet. So vitamin D has a ton of different benefits, and I feel like there's constantly research coming out on all the different benefits from vitamin D. So bone health, reducing the risk of heart attack and stroke, reduce the risk of asthma and allergy, and reducing inflammation. It's the sunshine vitamin, so spending about 15 minutes in the sunshine, getting sun on your face, your arms, your hands twice a week without sunscreen can give you probably an adequate amount of vitamin D. But important to know that it's one of the few vitamins that it's really a good idea to get a lab test and check where you're at as far as your vitamin D level. It's really hard to guess because everyone's different as far as how dark your skin is, how light your skin is, how much time you're spending in the sun. There's no real way to guess the perfect dose for everybody. So it's a good thing to get on occasion. And then usually we recommend vitamin D3 instead of vitamin D2 when you're taking it regularly. And that's just because it's a little bit better absorbed and kind of gets you to where you're going a little bit more quickly. Vitamin D is considered a fat-soluble vitamin, so taking it with the largest meal of the day has actually been shown to increase absorption by like 60%. So if you want to get the most out of your vitamin D, take it with your largest fat-containing meal of the day. And you don't want to overdo it, just like the calcium. If you have too much vitamin D, you can have adverse effects from that as well. So magnesium is something that I think we all love in integrative medicine. So it's wonderful. It can have so many benefits. Here's just a few foods that are rich in magnesium that you can add to your diet. Magnesium can be beneficial for cardiovascular health. They've shown it can decrease all-cause mortality, decreases blood pressure, and can really augment what you're getting with blood pressure medications. It can provide an additional lowering of blood pressure, which is nice. Can help with blood sugar, bone health, nervous system, which is really important if you have anxiety, irritability, depression. Can be very, very beneficial for that. Also with chronic migraines, magnesium can make a big difference. There's a couple different salt forms, and sometimes that gets confusing. So there's a citrate or oxide formulation, so you'll see like magnesium citrate or magnesium oxide. Those tend to be more helpful if you have constipation because the biggest side effect from those is diarrhea. So if you tend to be constipated, it can help you be more regular. The glycinate formulation is helpful if you're more prone to diarrhea. So you don't want to get diarrhea or loose bowels, but you're really looking for that nervous system support, the calming actions of magnesium. Glycinate is a great option. So the one caution with magnesium though is that if you have kidney problems, so if you have kidney disease or your kidneys aren't filtering very well, it's something you want to talk with your doctor about before you would take magnesium. Also, you want to make sure you're spacing away from calcium and your multivitamin, especially if they contain minerals, because again, magnesium can bind up and then you're just not absorbing as much. So omega-3s, this is a really hot topic. So I love fish oil. I think it's great. There's a number of benefits from fish oil, including the anti-inflammatory effects, possibly some cholesterol lowering. So it's great. These are the food sources of EPA and DHA, so the active form of omega-3. So mackerel, salmon, cod liver oil, herring, oysters, sardines, and anchovies are fatty fish, which are rich in omega-3. The total dose you want to look at is EPA plus DHA. So a lot of times on the front of a bottle, it'll say like 1,000 milligrams of fish oil. But then when you turn it over, it will say like 150 milligrams of EPA plus 300 milligrams of DHA. So what you would then know is it has really 450 milligrams of what you're looking for. So you may have to take more capsules to get to 1,000 milligrams than what it looks like on the front, if that makes sense. Also, I highly recommend the concentrated triglyceride formulation. This makes it so you generally have to take less capsules. It's more concentrated and more absorbable. So in the studies they've done on fish oil, they've shown that this helps bring up your blood concentration of EPA and DHA fastest. Alpha-linoleic acid is found in like flax, almonds, chia seeds. So this is another type of omega-3. The big thing to remember with this one is it's not really efficiently converted. So for most people, they convert about less than 10% of it to EPA and then DHA. So if you're taking flax and you're taking 1,000 milligrams of omega-3s, you're really getting about like 100 milligrams of the active EPA or DHA. So it's really not as much impact as taking the already converted EPA and DHA in a fish oil. Or they also, if someone is vegan or doesn't want to do fish, you G form, which is in EPA and DHA as well. You do have to be careful with fish oil. There is potential because many fish do contain mercury, so you want to watch out for heavy metal contamination. There are a couple different quality seals which they do testing to look for mercury. So making sure you check that out. Also, fish oil oxidizes really easily, so you want to make sure you keep it fresh. You want to make sure you keep it fresh, and if it smells, it's likely bad. So make sure that you're not, so if you get like a smelly fish oil, it may not be a good sign. One of the studies that I find really interesting with fish oil is if you have an oxidized fish oil, so fish oil that's gone rancid or has been exposed to air and isn't in the best form, it can actually increase your bad cholesterol by about 19%. If you have fish oil that's good, not oxidized, it can lower your bad cholesterol or your LDL. So that's a big difference. So if you're taking a fish oil with the hopes of lowering cholesterol, you want to make sure it's really not oxidized. A couple things to consider there. If you take it in a bottle of the liquid, as soon as you open that bottle, it's being exposed to oxygen. So you want to use up that bottle pretty quick. If you take it in a capsule, it's not really coming into contact with the oxygen. So capsules generally are preferred. Again, but if it tastes bad or smells bad, it probably is bad. And some people will talk about getting a lot of fishy burps or really tasting fish or smelling fish after they take it. Again, if you have that, I would try another formulation. You can try refrigerating it or freezing it, and sometimes people tolerate it better that way. But if it's really just a terrible fish taste, I would try a different manufacturer. I love this website. The Environmental Working Group puts out the Consumer's Guide to Seafood, which is great, and this can help you decide what seafood is safe to eat. It looks at how much mercury it has. It considers your age, your weight, things like if you're pregnant or breastfeeding, all sorts of those factors. So if you eat seafood in your diet, they recommend 2 to 3 times a week to get sufficient amounts of omega-3, but you have to eat the omega-3 rich seafood. And it probably shouldn't be the fried seafood. I would recommend baking it. So that's a great resource to check out. So to kind of start summing things up, as we offer integrative medication therapy management, one of the things that I really get at first is looking at diet and lifestyle, like I mentioned. Then we're going to avoid addition of medication and supplements to treat side effects of other medications and supplements. And so sometimes it gets a little crazy where you're looking like, well, I started this and then I had diarrhea, so we started this, and then, then I had constipation, so we didn't take any of this away, but now I have constipation, so I'm taking this, and you end up adding on multiple medications that maybe you don't need to be on anymore. We can also try working as a team with your provider, looking at discontinuing long-term medications. So maybe you've been on something for heartburn for a long time, but you haven't had heartburn in years. Maybe it's a good time to start thinking about coming off of that, or at least trying to. So the other thing we can be helpful with is tapering off of medications as your health improves. So as we work on diet and lifestyle, and you're feeling better, maybe your cholesterol is going down, maybe your blood pressure is getting better, we can start taking off some of those medications or backing off on the dose. We also really consider drug, herb, and supplement interactions. So as you guys are probably well aware, there's interactions between all of that stuff. And sometimes it's a lot to keep track of and try to think about, so we help you to sort that out. We also, as Brady mentioned, optimize the regimen to improve timing to provide optimal outcomes. And we consider drug nutrient depletions, which isn't something everyone always talks about. So this is just one way to do it. But for example, if you look at Prilosec or omeprazole, which is a proton pump inhibitor, it can actually deplete some of the nutrients that we need in order to be healthy and function well. And just because it depletes it doesn't necessarily mean you need to supplement with it, but it is a good idea that we look that you're getting enough in your diet and that you're not having any symptoms of deficiency. So important to consider, and that's something we do with integrative medication therapy management, is Brady mentioned, we're also studying pharmacogenomics. So it's a big word and kind of complicated, but really it's looking at your genes and individualizing care. So it's like the ultimate in individualizing our approach. So for some people, they'll take, all these people say are taking the same medication. One person may break it down really slow, one person may break it down kind of average, and then one person may break it down really fast and feel very little effect from it. So the slow metabolizer may have a ton of side effects. The rapid metabolizer may say, I don't even feel like I took anything, this doesn't work at all. So it's looking at how specific drugs affect each person. So again, the same patient group with the same diagnosis and the same prescription can have all these different outcomes. So what we're looking at really is kind of getting things just right. We don't want you to take too much or too little. We want it to be like Goldilocks and the Three Bears. So getting you figured out, the regimen kind of locked in so that we are just right. And one thing I like to say is it's not about a pill for every ill or a supplement for every symptom. We really, again, want to get at diet and lifestyle and make changes that are long lasting. I like this picture because a lot of what we do is mopping up the floor. So we're treating the symptoms, but we're not turning off the sink. So what we do in integrative medicine is really go upstream. Like, let's turn off the sink and then mop up the floor, right? So we want to look at what's causing those symptoms. All right, so that is what we have. I'm sure there's hopefully some questions. A few we kind of anticipated, which I can answer off the bat. As far as how to schedule an appointment, we're scheduled up at the hospital front desk. So really easy, you just stop in up there and schedule. Insurance coverage is variable. Some insurances cover it, some don't. I'll tell you, Medicare does not cover it. If you have Medicare Part D, some parts of medication management are covered, but it's not covered as a clinical service. Medicaid covers it very well. Private insurance may cover it. The out-of-pocket cost is around $150 or so. Usually that's very worthwhile, even with some savings just on changing around medications. People usually realize some cost savings after an appointment. And then what if I don't take any prescriptions, only supplements? And again, insurance probably won't cover it in that case, but certainly we'd still be willing to talk with you. I love talking